Millions of COVID vaccine doses have been given out over the past few months, and many of them by trained pharmacists. It's a profession few people thought much about before the pandemic. But COVID is changing the public perception of what pharmacists can do.
In this News 5 original, Kevin Barry explains how that change comes while pharmacists are trying to expand their role in the healthcare system.
8 years of training to become a pharmacist ended for Stephen FOSNIGHT with a global pandemic.
And it seemed like everything was a symptom of COVID.
It was an unexpected, real-life final exam.
Even as an intern, we were fielding a ton of questions about what was the truth behind the vaccine, and because there was so much misinformation that came out.
Northeast Ohio Medical University, or NeoMed students like Stephen, helped deliver some of the first vaccines in Ohio. NeoMed Seth Brownlee says that focused the spotlight on the pharmacy profession.
You know, it was a pharmacist who identified that there were actually 6 doses of vaccine in every vial that was dispensed. And so immediately it increased our ability to vaccinate by almost 20%.
But that extra attention and responsibility is something that pharmacists have been looking for years. The industry has been lobbying state and federal lawmakers to expand what they're allowed to do. NeoMed's JACLYN BOYLE says COVID just allowed the public to see why it's worth it.
Patients are seeing us more outside of the counter, right? We're providing these services in a way that we've maybe never been able to do before, or now we have new and more convenient capabilities.
Just like other medical professionals, JACLYN says pharmacists have been using telehealth technology much more during the pandemic to guide patients through their medication and answer questions about COVID. But one day, pharmacists want to have the right to prescribe medication themselves and see patients like specialists do.
We're training that next generation of healthcare professionals in a way that helps them practice for the future of pharmacy, not just how pharmacy is being practiced right now.
And anecdotally, Martin Ohlinger at the University of Toledo says more young people want to be trained to become a pharmacist.
The students that are visiting our campus as high school students, they've seen that increased visibility of the pharmacists and pharmacy students and techs out there in the field doing this.
In Cleveland, I'm Kevin Barry, News 5.